Hello viewers, welcome to our channel. Today Dr. Parbhu Kumar Challagali is with us, consultant physician and diabetologist at Elbit Hospitals, Banjara Hills. Hello doctor.
Hi.
Doctor, normally a diabetic patient will have lots of doubts about their diet. So what particular diet can diabetic patient eat?
You should balance your diet exactly. If you take more sugars, it is a problem. If you take less sugars, it is a problem. You will get hypoglycemia and you will die. So you should have a balanced diet. The first thing is you plan well about your carbohydrates and some pulses in your diet and some veggies in your diet and then some fats in your diets. So there should be a balanced diet including fiber in your diet. So there should not be more amount of sugars, there should not be more amount of proteins, there should not be more amount of fats. Nowadays many people are discussing a lot of diets. If you plan a balanced diet, that is good for you. You plan your requirement, how much food you need a day. Generally 2000 kilocalories. So a day needs 2000 kilocalories. So you should plan your diet accordingly, how much diet you need, how much work you are doing and how much diet you need. This is not a bank balance to load up sugars in your body or load up your reserve food. So you have to plan exactly how much food you need. Then what food you take. If you take 2 rotis and then a cup of dal, a cup of rice and some vegetables. You can call it a cucumber, you can add carrot, you can add beetroot, you can so you take some veggies with you and then some pulses and then some curd. That will end your diet. So in this way you should plan your meal a day. Morning you take whatever breakfast you need, which doesn't contain more fats. Plan according to the need of your body. So if you plan according to your daily requirement, then morning your breakfast, then around 10-11 o'clock a little food which helps you keep going. So 10-11 o'clock having some cucumber juice or having some general juice without sugars. Take some fresh juice. So you can add all these things accordingly and schedule your diet properly. Now, first thing for a diabetic patient, if you think, as I told you, in the morning, if you take a breakfast at 8 o'clock, after 2-3 hours, that is around 10-11 o'clock, you should have some bit snack there in that time. And then after that, again, 12-1 o'clock or 2 o'clock, you should have your lunch. In that lunch, you should have all balanced food, where it comprises of your carbohydrates, your pulses, your veggies. That completes your diet in the afternoon. Then around 5-6 o'clock you should have another small break where you can have some sugarless tea with some biscuits, where it marigold or some kind of biscuits, where multi-grain biscuits are available now in the market. So kind of biscuits, and then again around 7 o'clock you take your dinner. As I told you in the lunch, the same program can be applied here. Rotis, dal, veggies is important. You should use veggies in your diet like cucumber, carrot, beetroot. So different kinds of things are available. This kind of things should be added. And some fiber in your diet. The fiber veggies are available. So fiber veggies you can add. So if you have fiber, protein, carbohydrates, all things in balanced way, then you'll have a wonderful diet and a balanced diet. Don't increase your proteins, don't decrease your proteins. Don't increase your sugars, don't decrease your sugars. Don't increase your fats, don't increase your... So plan accordingly to according to your requirement of your body, your work, as well as the food. So when these 3 things balance exactly, your life will be fantastic in your diet.
Okay. So doctor, apart from diet, what are the lifestyle modifications required?
Every day for a diabetic patient, exercise is must. They should have a minimum 30 minutes to 1 hour exercise every day. Spend energy, so that spend your sugars, spend your carbs, whatever you are eating, that should be spent. So spend your time at least an hour every day on exercise. Whatever sport you like or whatever exercise you like, do it. Somebody likes cycling, somebody likes walking, somebody likes swimming, somebody likes playing. So whatever sport you are interested, you can get into that sport and spend around 1 hour a day. That will get your sugars down.
Doctor, what kind of exercises do you prefer for diabetic patients?
For diabetic patients, if they're young, they can do walking, they can do swimming, they can go for jogging. There are a lot of things for young patients. But coming to older people, they have joint pains, they have some other issues. So cycling is one easy process of doing. Cycling and then swimming is the easiest process for the joints not to get affected. So walking and jogging will not help the older patients. So older patients cannot walk much. So the easiest for them is to do some cycling at home or some little sitting exercises where they can spend some carbohydrates what they take.
Doctor, can you please explain what is diabetes?
Diabetes it's just a disorder of a pancreas. It's not a disease. The failure of working of pancreas unable to produce insulin causes diabetes mellitus. So when the pancreas is unable to produce insulin, it causes diabetes. So simple as it is. So the causes for this diabetes is important. So it requires a regular exercise. If you involve yourself in a regular exercise, then this diabetes will be under control. So failure of production of insulin from pancreas causes diabetes.
Doctor, can you please explain what are the types of diabetes?
There are 10 to 15 types of diabetes, but basically we will see 90% of the patients suffer from type 2 diabetes, which is called as a metabolic syndrome or lifestyle disorder. That is type 2 diabetes, the diabetes which occurs after 30 years. Generally, who doesn't have exercise, who had junk food, the Western lifestyle, all these things involves the Western food and all this involves the type 2 disease. Coming to type 1 diabetes is autoimmune disorder. It is a genetic problem. The cells itself kills their own cells in the pancreas. That is itself causes type 1 diabetes, which generally occurs in the younger group of people, very younger, including 5-year babies, 5-year babies, or 2 years babies, 3-year babies, whoever it is, below 15 years or 20 years below this age, we find this kind of type 1 diabetes. It's an autoimmune disorder. Not only this, you have also Modi, Lada, different other kinds of diabetes which is rarely seen in patients. Generally, we find type 2 diabetes in good number. Then with the infection, young people comes to us, that is type 1 diabetes.
Doctor, what are the symptoms for diabetic patients?
Generally in type 1 diabetes, they come with the infection, underlying reason, and then when we check his sugars are high. So there will be no production of insulin in them, the pancreas will fail producing, it is autoimmune. That is type 1 diabetes clinical features. Coming to type 2 diabetes, there is 3 P's: polyuria, polyphasia, polydipsia. Polyuria is passing urine constantly. Many number of times patient will be going to urine. So polyphasia, eating more food and drinking more water, requirement of food, polyuria, polyphasia, polydipsia. So patients we call it as 3 P's. Generally there will be sometimes a great weight loss in patients. Sometimes there will be some problems in the sexual parts like irritation, infection in the sexual private parts. Sometimes patient will be going to a dermatologist or a venereal disease doctor to know what is the problem he is suffering from. So when they do a diabetes test, they will find it as diabetes. So patients will have some sexual problems with irritation, infection in their private parts. Some patients will have more times passing urine. Some patients will be eating more food, drinking more water, general weakness, fatigue. All these things could be diabetes type 2.
Doctor, what are the treatments available for diabetic patients?
There is wonderful treatment. First, as I told you, it is a lifestyle disorder. Patients should have this, when they have this kind of problem, they should go for a test called, the important thing is first they should get a detection test done. Detection is done through RBS or GRBS or through fasting post-lunch or through HbA1c, glycated hemoglobin test, which should be below 6. HbA1c is another important test. So HbA1c, fasting post-lunch. In some pregnant ladies, we will do oral glucose tolerance test, or sometimes we do for all oral glucose tolerance. So the major thing is we should know the investigations. First thing is to detect the diabetes. So you detect the diabetes through RBS. The RBS should be below 160. Random blood sugar should be 160. Fasting should be below 110 or 120. Post-lunch should be below 160. HbA1c should be below 6. It varies from lab to lab. So, treatment of diabetes. There is a good variety of medicines available. There is oral diabetic drugs available. Anti-diabetic drugs. In oral form, we have a lot of drugs we can give. But basically, this is a lifestyle disorder. As I told you in the beginning, it's a lifestyle disorder. It's a disorder. So we have to make it into an order. First thing is, you have to do regular exercises. When you do regular exercise, walking and all, whatever sport you like, if you play for about an hour or half an hour or 1 hour, you can keep sugars under control. And then eat regular, nice diet, balanced diet. A good amount of, sugars, carbohydrates, good amount of proteins and limited fats. So all things together, a balanced diet you should plan. If you have a balanced diet, you should add some veggies in your diet, some fruits and vegetables in your diet, and then some rotis and pulses and all. This will form a balanced diet. You need a balanced diet basically. So one thing is you have to go for regular exercise, then for your good diet, then after this balanced diet, now comes your oral anti-diabetic drugs. There is different range and different drugs available in the market. So depending upon your structure, depending upon your physical, we will see and write a wonderful drug for you, what is suiting you exactly.
Thank you so much, doctor. Thanks for the valuable information. Thank you.
Welcome.
I hope you like this video. If you like it, please like, share and subscribe to our channel. Thanks for watching.
Subscribe our YouTube channel to watch more videos.